This is an ultrasound of a 60 years old female that relates to the kidneys. Now this is the left kidney in front of you, and the left kidney shows minimal dilation of the calyces and measures 6.2 centimeters by 3.4 centimeters, and it's lengthwise it's bit on the lower actually the minimum dimension of the in length should be 6. So at the age of 60, left kidney showing a dimension of 6.2 centimeters in length is definitely correlating with the fact that this is a small kidney in length, whereas in anterior-posterior diameter this is a normal size, and this is the important diameter. The most important diameter is this anterior-posterior. It should be within the range of 2.5 to 5 centimeters, and this is 3.3, so this it's okay. This is a minimal dilation of all the calyces. These are the pyramids, this is the cortex, and if you see the cortex and medulla are intact, but the cortex is thinned out. And this kidney will give you, you will go for an isotope study, radioisotope study for GFR and renal function to see that whether it is working 100% or there is some compromise in its function. The parenchyma measures 10.3, so it's okay. I mean, it's okay. At the upper pole, the parenchyma measures 11.7, is acceptable limit, normal limit. So, and at the lower pole, 10.7 millimeters. So the parenchymal thickness is intact. And the cortex measures 4.0 millimeters is acceptable for the rule. This is the spleen, this is the left kidney. This is the kidney, this is the spleen. So relatively small size kidney in the length, normal in anterior-posterior diameter, with minimal hydronephrosis of all the calyces, no calculus, no focal ileum seen, no hydroureter seen in the left kidney. Now this is the right kidney. Here you are seeing the right kidney. Measures 15 centimeters in length and 6 centimeters in anterior-posterior diameter, so a right kidney with now this is the upper pole of the right kidney. This is the upper pole of the right kidney. These are the pyramids, and this is the cortex. Cortex is thinned out here, no doubt, and the pyramids are significantly prominent. The upper pole calyces are dilated massively with total loss of parenchyma in this region, and where there are echoes, low-level echoes within this massively dilated upper pole calyx, which is consistent with either bleed or pus. Coming towards now, this is the lower pole. This is the anterior region. Anterior region cortex measures 3.8. It's also, you see, thinned out, and this is the proximal ureter measuring approximately 8 millimeters, and there is debris within it which can be pus or bleed. So this is the proximal ureter measuring 8.0 centimeters. This is the whole kidney, and I wish to magnify a bit to show you the details. Now this is a calculus giving posterior shadow at the dilated lower pole calyx, and these echogenic areas are very much consistent with clots within this dilated CALYCES, and this is the proximal ureter filled with debris. These CALYCES are also filled with low-level debris. This is the pyramid, the arcuate vessel, and this is the cortex with diffused increased parenchymal echogenicity. Here we are. So this is our case of the day. This is the calculus. See the posterior shadow weighing approximately 11.9 millimeters and at the lower pole. And this is our case of the day. Thank you very much. Now this is the dilated proximal ureter with debris. Here we can trace it up to this level. Here we are. This is the kidney in longitudinal section, and this is the proximal ureter. I'm going to move the probe downwards up to the urinary bladder to see if now you see here, this is the urinary bladder. Sorry. This is the urinary bladder, and this is the uterus, shadow of the uterus, and when I go little upwards here I see now this is a dilated distal ureter, and in the dilated distal ureter you can see that there is a calcified area seen. Let's take a cool picture. Here we are. Now this is in fact a dilated distal ureter, and we can see echogenic area within it. Which gives posterior shadow. This is the echogenic area giving posterior shadow measuring approximately 14 millimeters. And this is the calculus that is basically impacted in the distal ureter, distal third of the ureter. Here, this one. So you can see that if this is not it, but this is the kidney. This is the kidney. This is the proximal ureter. This is the distal ureter. This is the calculus. And so there is a uretary calculus seen, and around the calculus we see thick wall, that of the ureter, and we see shadow from this calculus. So this is the cause of all the findings that we were seeing in the right kidney. Thank you very much.